one of the YouTube session, question answer session. If I get time, if people join in early, I will start. I'll discuss some case which I have got recently very good results. So before that, I think we have some questions because there were a few questions which were unanswered last time. So I'll first take on the questions and then discuss one of the case. Yes, so you can ask me question. Welcome, Dr. Palak, Dr. Meera. So the case which I wanted to discuss today, I hope everybody joins in early so that I don't have to repeat every time. Lalit, welcome. So there was a case of vertigo, a very interesting case of vertigo. The patient had told that he had taken a lot of treatment, lot of scans were done, but still the vertigo was never okay. He was on Votin tablets for the past, I think, 3 months, but that was also not working properly. So he had to take more tablets. First, he was taking 8 milligrams, then he was taking 16 milligrams tablet. Yeah, good afternoon, Dr. Borkar. So now what happens, he came to me and the first symptom, the first thing which he asked me was, can this be cured with homeopathy? Because whenever I become very anxious that will it happen or not, whenever I become anxious, I get vertigo and sometimes very cramping pain in the chest. Welcome, doctor. Welcome, Ankita. These were the symptoms which the patient discussed, and in my mind at that time, one remedy just clicked my mind that I knew that this would be the case, the remedy of the case. Thermos, the patient was hot. Welcome, Dr. Babel. Dr. Hetal, I think. So a very simple case, but definitely which remedy comes to your mind? The patient comes and vertigo for 3 months duration, taken a lot of treatment on Votin tablet, 16 milligrams, all reports normal. Comes to me in the chamber and said whether this will be curable, because whenever I'm thinking whether it will be cured or not, I'm going out. Whenever there's an event, I feel very anxious, and then vertigo starts and this cramping pain in the chest. Yeah, welcome, Dr. Gunista. Yeah, good afternoon, Dr. Robbins. So this was the case. So which remedy comes to your mind? Anybody? Which remedy comes to your mind? In fact, I didn't repertorize the case, but I just gave that remedy, and the patient with the first dose was so much better, and he got so much confidence. We gradually tapered off the dose from 16 to 8 milligrams, and then we stopped the tablets. The remedy which I gave was Cactus grandiflorus. Cactus, remember, whenever there is vertigo because of anxiety, there are in your repertoire there are a lot of remedies, but the remedies which I have seen working during in my practice is Cactus, causticum, digitalis, and sulfur. These are the main use remedy which I use in my practice. I am telling you this because if you open the repertoire, like the latest versions of the best repertoires, you will have in one rubric so many. Before that, maybe 10 years before, that rubric contained 5 remedies. Now that the rubric contains about 25 remedies. So everything is covered in that rubric. But I'm clinically telling you that I have found very good results with Cactus, causticum, zincum, opium, sulfur. These are the remedies which have given me very good results. Welcome, Dr. Busari, Dr. Yeah. So I hope Cactus grandiflorus, and if you see Cactus grandiflorus, it is very beautifully written that fear of death believes that the disease is incurable. Don't always prescribe Cactus only for that, case sensation in the heart, lot of constriction in the region of the heart has no space to breathe. Cactus grandiflorus has lot of other actions. In the first action which I found is fear of death. Believes that his disease is incurable, exactly like arsenic. This is a very, very important symptom of Cactus grandiflorus. Welcome, Dr. Amit. And it is also given, I have seen in one case with a palpitation. Palpitation is very, very important indication again of Cactus grandiflorus. This palpitation day and night, worse when the patient is walking and lying on the left side, or before menses. Don't always think of pulsatilla or lachesis or zincum. These remedies have the symptom, but Cactus grandiflorus also has the Very important symptom. There is a lot of palpitation day in and day night while walking, lying on left side like lachesis, and at the approach of menses. These are so many important symptoms of cactus grandiflorus. Yeah, welcome Dr. Navjot, Dr. Yadav, Dr. Amit. So this was the case, a case of vertigo, very interesting case of vertigo. And before I could give the appointment for the case taking, I just prescribed cactus grandiflorus 1 ml single dose. Within a month's time, we tapered off all the medicine and the patient is still much better after 6 months of follow-up also, which 1 dose of cactus grandiflorus. So this is, I always tell to all my assistant doctors who are with me, try to define the symptom of the patient, try to see what is important, what is a different, as Dr. Hahnemann says, deviation from the state of health. That is very important. Understand that first, and then you'll be able to make a good totality. Yeah, one question, remedies when patient says if I press my body part, I get eructation, that makes me feel better. Oh God. Now this type of symptom, you will get in so many of patients. This is called as aerophagia. That means accumulation of gases in the tissues. And this is a very common problem. And this problem most of the time is related to mental stress, especially insecurity, where the patient is not able to digest some facts, some things in life. Because of that, it is increased so much that even by slightest touch, mental or physical, he gets eructations. So the remedy you have to think about in these cases is, I have seen good results in case with Valeriana, Iris versicularis, Lycopodium, and of course, don't forget Carbovage. Why I am telling you? Because I had a case, when I was treating maybe 10 years back. So I told the patient to lie down and started examining the patient. Whenever I touched the patient, he used to get eructations. So at one point of the time, I did not touch the body and the patient had eructations. That means it was more psychological rather than practical. And in that case, Valeriana worked very well in my case. Okay, I hope Dr. Vishal, you understood. He's on Instagram. Dr. Yadav, due to stress. स्टेरॉइड्स के साथ होम्योपैथी मेडिसिन कितना काम करती है ऑटोइम्यून डिजीज में? या यादव, डॉक्टर यादव, वेरी गुड क्वेश्चन. एंड लेट मी टेल यू, in fact, in post-COVID cases, we have got lot of cases of avascular necrosis of femur, AVN. Previously, we used to get 2 or 3 cases in a year, but now I am getting 2 or 3 cases every month. So, and in AVN, the patient, the last treatment basically is steroids. Okay. So in that case, our question would be whether it works or not. In case of arthritis, where it is long-standing, the patient has taken a lot of steroids, that also comes to us. In case of psoriasis, they also come to us with lot of steroids intake. Now, the main question, whether to start the treatment with Naxomica to basically stop the action of allopathy medicines or to give a constitutional treatment. This question I also had, but then years back I have noticed just 1 dose of Naxomica will not take care of the steroid dose. So in this case, make sure that you give the constitutional medicine. Please give a constitutional medicine single dose, and if your medicine is right, automatically the patient will feel better and he will start reducing the steroids. The medicine will act unconditionally whether the patient is taking steroids or any other medicine. The medicine will act, remember, the medicine will act unconditionally provided your medicine is a similimum. And to add to that, if you give these type of patient LM potency in repetition dose, it would work even more better. Okay, I hope Dr. Yadav you understood. Sir, tell us something about rheumatoid arthritis. Now see, rheumatoid arthritis, first of all, autoimmune disorder. I've always told, if you had heard my talk with one of the doctors, I gave an interview, I told something about psoriasis. Why does psoriasis occur and what you have to ask in psoriasis? I hope you must have seen that it was an Instagram live. Please go and see that, because I have got so many WhatsApp, so many calls telling me thank you that you have specifically told how to approach a case of psoriasis, which I have seen in my practice. That's why in case of autoimmune arthritis. Now we have gone to autoimmune arthritis. In case of autoimmune arthritis, you have to remember one thing. Autoimmune means the body is trying to harm ourselves. The body is trying to harm yourself. And believe me, in autoimmune disorders, arthritis cases, Dr. Bawa, it is only the 1 and 2 syphilitic features of the patient's constitution. That you have to take for prescription. Don't take arthritis pain, very severe pain, aggravated night, lot of swelling. This will only relieve the symptom temporarily, but it is like a big bubble. It is like a big, it's like a big bubble. You just have to take a pin and burst it. Just one dose of that homeopathy medicine, just as the syphilitic symptom, and then you'll be able to cure that case. See, there are two types of practitioners who will tell you theoretically some remedies of arthritis and lot of other things. But practically just 2 syphilitic symptoms of the patient, ask from SORA to psychosis to syphilis, the 2 syphilitic symptom which is always there. Because unless you get a similimum, the body will always cry for it. If you have seen my template, I have made a template that the truth is similimum. So always try to get the truth, that is try to get the similimum. Just 2 syphilitic and the case is cured. Yeah, Dr. Nazim Dani, welcome. Dr. Sonali, Dr. Pratibha. So just go and just see my Instagram live on psoriasis. It is very beautifully, I'm not patting my back, but I have made an effort to understand and to see how to approach a case of psoriasis in the same way it is approach of arthritis. Sir, let me light on Lactodactylus mecanthus. Oh, Lactodactylus basically one of my favorite remedies, The patient has a very typical symptom, Dr. Amit. There is severe precordial pain, which extends to the axilla and down to the arm, even the forearm and the fingers. And there is numbness of the extremities. That is the most important symptom of Lactodactylus mecanthus. I'll repeat again. This is a prescribing symptom. Theoretically, the pulse are feeble and pulse are rapid, okay, which you're not going to see from the patient. The first symptom that Lactodactylus mecanthus, the patient tells you, there's a violent precordial pain which extends to the axilla, to the arm, to the forearm, to the fingers, with numbness, Dr. Amit. That is very important, with numbness. And then you can have a lot of other symptoms like there is extreme apnea, there is gasping respiration, and the patient fears that he will lose his breath. But the most important symptom, the precordial pain. That is the most important symptom which I have seen and given to the patient in cases of chest complaints or angina. Okay, it is basically a very typical picture of angina. If you have read angina from the book of medicines, you can match that in Lactodactylus mecanthus. Okay, in fact, if you open Fatak's Mater Medica, it is written violent cardiac pains. Violent cardiac pains. Okay. Yes, welcome, Dr. Badana Seth. I'm sorry if I'm not able to pronounce the name properly. In heart symptom, yeah, Dr. Kocher, Dr. Yadav, thank you. Yeah. So Dr. Babal, clot formation after mRNA vaccinations appear to be different from normal blood clots. Are the same drug indicated as for blood clots or in different approaches required? First of all, that is acquired from outside. Okay. So if something is acquired from outside, just ask after he has acquired that clot, what is the deviation of the patient from the normal health? What symptom that clot is making? The remedies, of course, would be same as what we are using, but in this case, you have to be very much sure what is the deviation from the state of health after he has acquired the clot. Of course, without going, Dr. Babal, just first start with COVID-19 nosol, which I have made, give a single dose and see how does it affect the case. And then if the symptoms are there, you can prescribe on normal clot remedy which we give. But aphorism number 6, that is, normal deviation from the state of health and the COVID-19 no sold. Sir, I have a case of arthritis after COVID vaccine. I gave him Thuja 200. He feels better in symptom, but RA factor is raised first then lowered down. Is this cure? Whenever you are taking a case of arthritis, okay, Dr. Navjot, mind blogger, welcome. Remember two things. Of course, we always say that in homeopathy there has to be a sense of well-being. Just I'll go further and just go and read lectures of lesser writings of Kent. He has said that what we have left behind is what we want in the body. I'll tell you an example. A patient comes to us and says, Doctor, I have arthritis, I have this, that. But previously I used to like to go paint, I used to like to go out, I used to like to enjoy, I used to like to have fun. But now everything has been taken care of. Just I have left living my life, I'm just existing, and this pain is there, which is crippling me. Welcome, unprejudiced observer. So when that arthritis has to be cured, the patient has to come and tell you that, sir, so after so many years, I've started painting and enjoying life. Though my pains are okay, though my pains are still there, but I've started enjoying life. So what is left behind is what is to be cured and what has to become. That is Dr. Kent has said. And this in case of arthritis. If that has come, then it is a cure. Every time you will not get immediately everything on the skin, but this mental state has to come back, and that is the starting point of cure. Of course, in arthritis, please see the patient at least for a year follow-up, so that the patient doesn't, because in autoimmune disorder, so the patient cannot come back and tell you, sir, I was better for 2 months, but again I've got arthritis. So it is very important to have a good follow-up, and when to repeat the medicine, that is also important. Yeah, Dr. Babal, thank you. Walaikum assalam. Dr. Almagir, Dr. Vaishnav, welcome. Can you shed light on viral fever going on, symptoms of body ache, heart pressure, less thirst, palpitation, morning diarrhea, had? Yes. So very good question, and I think I have in many of my YouTube I have told something about viral fevers, but if you have asked me question again I'll tell you. See, in most viral fevers, what happens, the first drug that we think about is arsenic album. Now a patient comes to me. I'll just narrate you one symptom. I'll just narrate one case. Yesterday only I had a cure. She said, I have lot of discharge from the nose, especially left. There is lot of body ache. There is headache, and whenever I go to sleep, I have stuffing of the nose. I cannot breathe, and this is since morning. So which remedy comes to your mind? She had body ache, she had left-sided discharge from the nostrils, she had mild headache, appetite lost, not feeling well. When she goes to sleep, she cannot sleep because there is obstruction in the nose. Which remedy comes to your mind? Anybody? And she is cured. Today morning she has called me. And she has said she is absolutely fine and the fever is gone, the obstruction is gone, she can sleep, and now she is eating food also. Simple remedy. I gave her 1 dose of Allium cepa, 200 in the morning and 1 in the evening, and she is cured. Neither arsenic, nor China horse, nor Upit, nor Puff. Allium cepa. Allium cepa is a very, very important medicine. If the history is very acute and the patient say discharge from nostrils and obstruction from nostrils, because of that body ache, headache, first understand what was the prodromal symptom. Beautifully written in Allium cepa. Beautifully written. If the patient comes and tells you, sir, there is a lot of watering from the eyes, there is pain in the eyes, and because of that there is a lot of headache and mild feverish and body ache, don't give arsenic. Don't give arsenic. Dr. Badani says I am not audible. Anybody on Instagram? I am not audible. I'll just check with my team, because they have Instagram. They feel that I am not audible. Am I audible? Anybody on Instagram? Can they tell? Okay, I'll just continue because we have less time. Anybody? Can you hear me now, Doctor said? So this is basically allium cepa. That remedy which I told you, when it starts, when the patient tells you that watering from the eyes, audible. Okay, fine. Dr. Pratibha, thank you. Give that patient euphrasia. Don't start arsenic. Now, when to give arsenic? Remember, an arsenic patient will have lot of prostration with sinking of the vital forces. The whole body is involved in arsenic album, and there is lot of mental restlessness and anxiety before the fever starts. Arsenic album. The patient comes and tells there is lot of weakness, doctor sahab, I have no fever, अंदर से slight feverish feeling but no fever, but lot of weakness, I cannot get up. Start with China horse. And the patient comes and tells you, doctor sir, I have lot of pain in the body, my whole body is paining, I have told my children to press the body, there is so much pain in the bones. Then you have to start with Eupatorium perfulatum. So understand how was the onset of disease. How was the onset of disease? That is very important, and then you will be able to see that you can cure viral fevers within 1 or 2 days. Of course, the remedies are very few. I just narrated a case, doctor, who has asked me the question. I don't know. So I just cured a case where I told you the patient had severe pain in the throat, But when I went home, I saw the patient, the whole face was like dusky red. And dusky red, pain in the throat, immediately I gave nitric acid, and within hours, not even days, the patient was cured. Arogya Homeopathy, welcome. So this is how you have to first see how did the disease, acute disease start, and then go and pick up the remedy. Rustox has different, Dalkamar has different, okay? Everything is different. So I'm just telling you, you can go home and see my YouTube videos. I think 2 weeks before I had told something about viral fevers. It would be repetitive for some of the doctors, and just believe me that I only will tell you and share some clinical symptoms. Don't tell me that I'll tell you dragging pain in the body and goning hunger and stitching pain. These are all there, but what the patient tells in the patient's language is more important in prescribing. So I am more of clinical, okay? So Dr. Sangma has, hi sir, will it be possible to treat neurofibroma type 1? What would be the medicine to? See, what happens, Dr. Sangma, after 25 years of practice and probably by the grace of God, probably curing diseases, syphilitic diseases like cancer or brain tumors or renal failures or cardiac diseases, I always believe one thing in homeopathy: everything which is curable on earth is curable with homeopathy. Never lose hope. I had few cases of DNS where the septum was deviated, and when I started the treatment, the patient and the allopathy physician also told me, how can you make that septum straight with medicines? I told her, don't know, but I'll give a constitutional dose, and believe me, on the scan, on the CT scan, the deviated septum has become normal. Just now I cured a case of fibroid where the fibroid was 9 centimeters and is totally cured within 6 months. Everything is curable. Just it is important your case taking and which symptom you pick up for prescription. That is very important, Dr. Sangma. Dr. Minde has one. Please suggest medicines for severe osteoarthritis of old age patient with potency selection, especially where the patient refers to joint replacement. Dr. Hima Kulkarni on Instagram, welcome. See, Dr. Minde, old age means if the patient is 70, 75 plus. Remember one thing, that if a bowing has taken place, means two legs are like this. Sometimes bowing occurs, this is like this. So patient walks like a penguin. So whenever you will start walking and put pressure on the knees, it will keep on bowing. I have never seen that the bowing of the tibia has come to normal. Because of this alignment of the bone has been damaged. So automatically all the cartilage will be degenerated and the patient would require knee transplant. So tell the patient to wear a crepe bandage and give some acute medicine first to relieve the pain, and then do a good case taking to get the remedies. For example, in these type of cases, remember that in these type of cases, old age cases, if they come to me and there's a lot of pain, I use LM potency in repetition. The most important remedy which I use for repetition, you can write down. It is my secret, Dr. Mende, but it will give you good relief. It is basically guaiacum, formica rufa, Gaultheria, Nigudium. These are very, very shortly acute remedies. You can repeat that in impotence and the patient feels better. When these acute episodes are better and the patient has a lot of faith in you, then go in for a good case taking. And the chronic remedies which I have seen, which has come to my practice, those are which basically will stop the progress of disease, and the patient can be shared with knee transplant if the bowing is not too severe. If the bowing is very severe, then it's better to go for operation because the whole alignment has been damaged. So the chronic remedies you must think about is Merxol, Silicea, Asafoetida, Calcarea carb. These are very, very important remedies. Then there are remedies like phosphorus, lycopodium, and kali iode. Kali iode is also a very fantastic remedy which will give you very good results. Chronic remedy when the acute episode you have dealt with very properly. Welcome, Dr. Anamat Homoeopathy on Instagram. I hope I could give you some answers in regards to osteoarthritis of old age especially. Dr. Sharon says, hello sir, severe constipation, burning stool, heart dark in color, nausea on seeing the food and weakness. Just open nausea on seeing the food first. And I think there will be so many remedies, in homeopathy, once you say nausea on seeing the food, so you can think of sepia or colchicum or pulsatilla, a lot of remedies. But in your case, it is with severe constipation. So whenever there is a severe constipation and burning in stools, always think about something which basically some thought process which the patient wants to take out but is not able to take out. That is the implied meaning which I have seen in constipation. Of course, symptomatically I have told you some remedies, and with severe constipation, if you club that, then you'll have remedies like Calcarea carb, you'll have remedies like opium, Calcarea floor, and alumina, which covers both the symptoms. But do ask the patient something in relation to mind which he is not able to take out, and because of that, there is severe constipation. Of course, make sure that to give a proper diet to the patient, give a lot of salad, drink a lot of water, take a lot of fruits and fibers, and that will take care of the constipation also. Dr. Gupta says, approach aerophagy, excessive desire for swallowing air. Please give appropriate term. I'm not able to find the proper term. See, when you take a lot of air, basically it accumulates in the tissues, and because of that, there is a lot of gas and a lot of eructation. So it is either wise, air accumulation. It is either wise. You can take it as swallowed air also, and there's a lot of accumulation of gas because of rise of the bicarbonates or content in the tissues, and that also causes aerophagia. Both the things you can take, but basically that may cause aerophagia may cause abdominal distension, lot of bloating, lot of belching, lot of flatulence. It is accumulation of that air in the tissues basically. It is written in a book that a lot of laughing, a lot of talking, which call a lot of accumulation of airs, but basically the symptom is it accumulates in the tissues, and that causes distension and bloating and flatulence, and those are the remedies. Sir, can anything be done to prevent moles? No, I have not got this type of cases. I have never treated a case where I have prevented moles. Of course, I have given some remedies like carcinosin or fluoric acid, but I've never seen such exclusive cases. Only comes from moles. It is basically I have seen in my practice aerophagia is basically more of psychological, because a normal person, when he takes normal air, normal laughing, normal, but that person basically develops that type of habit of distension and belching because he has a habit of accumulating those things and trapped in the tissues. So in a normal person it's not there, and that's why it's because of some some thought which is not able to take out from the body, and that's why develops more of arophagia like symptoms. That's why it's more of psychological. You can't expect a person to just sit and just taking it and then come to arophagia. A normal person eating, sleeping, drinking, laughing, talking like us, but one develops and one does not develop. So there's always a mental element in that also. So calcaneus bone pain, patient has calcaneus deficiency, post-menopausal flushes, patient is overconfident, arrogant. Hot patient, can you suggest me the remedy, sir? Yeah, whenever you have got these type of cases, do think about calcareous sulf, do think about sulfur, do think about acute remedies like Arinia diadema, ledampal and ledampal. Sorry, because I have to answer both on Instagram and this also. Sir, I just shared the photo of neurofibrom. Okay, I'll just check it and get back to Dr. Sangma. Sir, how the patient approaches with the pain in chest in spots, and how can we differentiate with oxalic acid and spigelia? Pain in chest and how we can oxalic acid and spigelia. See, whenever you are prescribing, first of all, whenever you are prescribing on a particular case, for example, in case of spigelia, now don't limit yourself, don't limit your materia medica to only one part of spigelia, that is cardiac pain. Because see, whenever a patient comes with cardiac pain, it is very important to first assess whether is pain in the cardiac region and why is the pain. For example, we talk something about pink root. Pink root means spigelia. So whenever a case of spigelia comes to you, and if you only want to remember that what you call chest symptom of spigelia, remember spigelia does have some chest symptom, like in spigelia there is lot of palpitation. The palpitation is very much, and the patient says that he craves hot water which relieves the complaints. Why craving for hot water? I mean, remember, because chilidonium patient also wants everything very hot. But in spigelia, if you see violent palpitation and craving for hot water which relieves the complaints. And there is neuralgia extending to the arms or both the arms, and there is frequent attack of palpitation. The patient is better one day or in the morning, and again palpitation in the evening, and then again in the morning, and he's better in the evening. So there is frequent attacks of palpitation. The most important symptom of spigelia is with foul breath from the mouth. Now, materia medica wise, okay, it is very, very important to understand this, but do think about other symptoms also of spigelia, and go ask the patient why he is suffering from heart complaints. This is, you'll be able to take a wider view, so you'll be able to cure a lot of complaints, because symptomatically you may cure with spigelia, but again the patient will come back unless you understand the case thoroughly and prescribe as a whole. I hope you got it. I hope, who asked the Dr. Amit, I think. And then maybe oxalic acid. Now, if you ask me, if you have asked me oxalic acid, I'll tell you oxalic acid, but I have not used oxalic acid in complaints of heart disease, because there are other so beautiful remedies which cover the whole case rather than particular part. So if you see oxalic acid, and if you compare oxalic acid symptoms with spigelia, oxalic acid basically has nervous aphonia. Nervous. In oxalic acid, patient says, oh God, I had a friend, he suffered from a heart attack, his cholesterol was so high, and suddenly I could not speak. So nervous aphonia with cardiac degenerate, that is oxalic acid. In oxalic acid, one thing is very important, that there is left lung is very painful. The left lung in oxalic acid is very painful, and there is a sharp pain in the lower region of the left lung which extends to epigastrium. That is oxalic acid. Only these symptoms I remember of oxalic acid and spigelia. Spigelia, of course, there are a lot of others, but these are the differentiating features of spigelia and oxalic acid. I hope, Dr. Amit, you got something about it. In relation to burping by touch, any body part, yeah, I have just told you. It is more of sometimes psychological in a normal person. Yeah, good afternoon, Dr. Meera. It's already half an hour, so I'll take few more questions before we close. Yeah, so Dr. Paul Sangma, you have showed me the case of neurofibroma. I know the case of neurofibroma. I'll just check on the WhatsApp because I don't know how to check it now on a live. We'll get back to you. But believe me, one thing that you all have to believe that just take a good case, just take a good symptom, miasmatic symptom, and just be a spectator and let the remedy do what it can do. In case of neurofibroma, where there is a lot of neurofibroma on the whole body, at least you can minimize that. Some will shed off. So you can make the person's life better and improve his quality of life. That is also important. Okay, I'll just check and get back to you. So, any other questions left which I have missed out? Dr. Meera, good afternoon. You have joined late. Homeopathy in ringworm, we have a question on Instagram. Yeah, firstly, I have told you before also, ringworm, if you ask me also, a very irritating disease to be cured, because sometimes how much we try, but the remedy does not work. I have found remedies useful, as I have told you before also, like sepia or tucarum marum verum or basilinum, sulfur, graphitis, and rare remedies like Azadirect indica, Ichnisia. But let me tell you again, all ringworm or fungus or viral skin which comes on the body like herpes zoster and all, they come in the body because your immunity has got low. That's why corona has come. No? So make sure after you cure this or after acute remedy, make sure that you take the whole case, so you find out where did immunity go low, and your constitutional remedy will help the patient to fight that virus, to fight that ringworm, and fight that fungus. So if you give a constitutional remedy also, that will help to the body to gain the immunity and fight the virus. There's no need for an acute medicine also if your similarium is right. One more question from Instagram. Child asthma, fear of downward motion, wants to sleep with light on, likes wearing camouflage clothes. See, you have told very beautiful symptom, and beautiful symptom mathematic also. So these are the very common symptoms which are very, very important in remedies like stramonium or bismuth or kalicarb or borax. You just see the differentiation and you can find out the remedy. Elements from sudden noise from fair now covers his ears with noise. Whenever there's element from sudden noise, now you see, just by sudden noise, and if the patient is not, if the patient basically has developed some symptoms, there are a lot of remedies. You can think of remedies like aconite to opium to coffea to stramonium to thuja, but understand why has the patient reacted so much. That is important. His reactivity is very high. So you have to understand why did the patient react so much, so that today because of noise he has a problem, tomorrow with shock he'll have a problem, mental shock, third day he'll have something problem. So the body is reacting violently. See that why is the immunity, why is the constitution so weak, because of which he's reacting so much. And that if you see, you can give a similar miasmatic remedy so that the whole constitution gets cured and not only one part, that is noise. Any more questions or we are through with this? It is 3:40. I can take one of a few questions. If there are no questions, I think all questions answered. Everybody is understanding homeopathy much better, I think, than before. I hope with these YouTube lives. So I think that's all for today. And thank you for joining and thank you for spending your time with me. Thank you so much.